Ruthless Compassion is a podcast about people who've turned their emotional shit into fertilizer for success. It's about seeing our darkest moments as opportunities for growth and transformation. This is part 2 of my interview with Dr. William Li, the world-renowned physician, scientist, speaker, and author of Eat to Beat Disease. In episode 2, we will continue our fascinating conversation with Dr. Li and learn more about different ways that the body can heal itself. Now I'm going to ask you a personal question just for me. My family history, there's a lot of dementia. And I'm always trying to find out things that I could do for myself that might help ward it off. You know, I do a lot of exercise. I definitely try to eat healthy. But is there any kind of food or foods that might help to ward off dementia?
You know, that is literally $1 billion question, right? Mm-hmm. I mean, because if we knew that, we could change all the suffering that's out there from people who are suffering from dementia or are likely to suffer from it in the future. And part of the problem, and you're a psychiatrist, this is an area that's in your wheelhouse and you will know more about it than me, is that we don't fully have our arms around what is dementia. It's not one disease. It's probably a lot of different things. And the way that people have difficulty navigating and relating in their life when they have dementia, they carry that diagnosis, which is, way oversimplified. It's probably a convergence of a lot of different things that occurred over the course of their life that led them to this common, looking problem at the very, sort of in the tail end. But I'll tell you some things that excite me that relate to food, relate to health defenses that I think are important. I think that we're beginning to discover that there is a link between our gut microbiome, the healthy bacteria in our gut, when it's not so healthy, with what happens in our brains in terms of aging and dementia. There's sort of this microbiome profile that is starting to emerge linked to certain kinds of dementia, including Alzheimer's, which, again, probably isn't a single disease, but a lot of different ones. And so I'm super interested in research that is going to help us figure out how do we right-size the neighborhood of our gut bacteria. Is there something we should be doing, more foods that we should be eating? And so we do know that eating lots of fiber in our food, insoluble fiber, fruits and vegetables, by the way, are just a great source, and nuts especially are a great source of dietary fiber. When I went to medical school, what I used to tell my patients is that, dietary fiber just helps move your bowels, so you actually are more, quote, regular. But it turns out the benefits of fiber are probably that they act as a prebiotic, and what we don't absorb in our own bodies, we're feeding our bacteria neighborhood, and the bacteria are eating that fiber, and they're, as a consequence, are releasing lots of byproducts from the fiber of what the bacteria digest, the good bacteria that impact our whole body. And I'm sure that one of the things we're going to find is that some of those bacterial products actually help our brain stay healthier and resist dementia. The other thing that I think is really exciting and interesting to me is that I don't know if you saw this recent study that looked at the link between the mouth microbiome, the oral microbiome. So when people talk about gut microbiome and gut health, a lot of people don't realize that the gut's more than your colon. The gut starts in your mouth. So our gut microbiome is also in our mouth. It's in our gums. It's on our tongues. It's in our throats. And there was a study that came out just about 6 months ago that showed that the oral microbiome, the mouth, the bacteria in your gums, seemed to be correlated with Alzheimer's disease, which I found super interesting. And they found people who had Alzheimer's tended to have a particular type of bacteria. I can't remember the name of it right now, but this study really stuck in my mind. That's very commonly associated with gum disease. Now think about it, as people get older, it's harder and harder for them, and they probably just generally don't take as good oral care as they should. And so gingivitis looks like it's one of these, quote, risk factors, and we're beginning to discover some bacterial connections. So how do you actually treat gingivitis, right? Well, besides going to the dentist, because what dentists do to treat gingivitis, sometimes they write a prescription for mouthwash that contains powerful bacterial killers. those dental bacterial killers actually wipe out good bacteria in your mouth as well, which is not a good thing. So I discovered that there is a bacteria that's found in food. It's called Lactobacillus reuteri. Lactobacillus is just a family of bacteria. Reuteri is a kind of subfamily. So Lactobacillus reuteri, or L. reuteri, I just call it reuteri. Actually, it's a bacteria that's used to make food. So it is the starter bacteria that's used to create sourdough bread. That's why sourdough bread is sour. The lactobacillus actually makes it a little more acidic. It secretes lactic acid. And real traditional sourdough bread has got lactobacillus in it. So does pumpernickel bread. So it turns out, though, that researchers have found that Lactobacillus reuteri, this particular bacteria, which, by the way, is also found in Parmesan cheese. So if you look for the Italian Parmesan cheese, this is the bacteria that's actually used to make Parmigiano Reggiano. So it's found actually in our food and sometimes in yogurt as well. And you can also get it as a probiotic. But Lactobacillus reuteri, when you have it in your mouth, you chew it up, there's like chewable tablets or food with it will actually get in your mouth. It actually competes with and gets rid of the types of bacteria that can cause cavities and gum disease. So now you can fight bacteria through the food you eat or by probiotics. And so that's a super interesting thing to me. And although it's too early to say that this is the way to prevent dementia, I think that we're going to move into this direction to figure out exactly how. In the meantime, if you really enjoy sourdough bread or pumpernickel bread or Parmesan cheese, just don't eat too much of it. This is another way to actually use this sort of new research that's coming out to lean into something you already enjoy. What I always say, this is like always been my call to action is, love your food to really love your health. Find those things that you already love that actually can support your health.
That's amazing. Now, these days, there's a lot of diets that people go on that they think this is going to, get me really healthy. So, my computer tech was over a little while ago and he was going on and on about how he was on the paleo diet and it was the greatest thing. And then another person I was talking to says she's on the ketogenic diet and she's just, raving about it. And then somebody else I know is on the blood type diet. So, do you have anything to say about all these diets that people go on for their health and they think that this is going to be a good thing? Like, are these good things?
Yeah. So, I always struggle with this idea of diet sort of being universal. First of all, most diets are about weight loss, and that's okay if that's your goal. If you're an actor or you're an athlete and you need to lose some weight for a particular thing, you got to cut down your weight. There are different ways to do it. But the average person who goes on a diet will embark on a program that tends to be pretty extreme or pretty rigid, and it's usually about cutting things out. And it's very, very, and while you might lose some weight in the short term, it's very difficult to sustain it over the course of your lifetime. For me, I think the word diet has become kind of a loaded term because what does that mean anyway? In reality, a good, healthy diet should be something we could actually, carry out and stick to our whole lives without having to struggle or, quote, cheat, fall off the wagon, so you're not eating a bunch of bad food for one thing. All of a sudden, you can't stand it. So you're going to go out and pig out on something that's really bad for you. Oh man, I fell off the wagon, but it worked for me for the 6 weeks I was on it. I think that, there are certain diets that actually do have some sense. And I would say they make sense if you have a particular situation. So for example, the ketogenic diet actually is really interesting. And although the pop version of the ketogenic diet, I question that myself. I mean, I think that it'll help you lose weight and everything else, but it's not particularly healthy for your defense systems. But if you have cancer, particularly research has been done for people with brain cancer, brain tumors, or if you have epilepsy, for example, it turns out that switching your body's metabolism to create ketones seems to be able to have a beneficial effect by thwarting and killing off brain tumors. Okay, or at least slowing them down. And also for epilepsy, it seems to have a beneficial effect for, when the drugs don't work, turns out that the ketogenic diet can be useful. Intermittent fasting is interesting, right? So intermittent fasting, there are prescriptions of how to do intermittent fasting. I'll tell you, I probably have been doing intermittent fasting for most of my career, because sometimes I'm so busy I don't have time to eat breakfast, or sometimes I'm so busy I don't get to eat lunch. If you're not, getting a regular meal in 12 or 14 hours, you're pretty much, you skip a lunch or skip a breakfast, you're probably doing intermittent fasting. That's in some way, shape, or form. And turns out that when you do intermittent fasting, you actually reboot your stem cells. So it causes a fresh batch of stem cells to be made in your body, which is a good thing for repair. It also helps the microbiome reset, because during your fasting period, your good neighbors actually take the time to kind of package up and get rid of some of the bad neighbors in the microbiome. So that's another benefit that we've been seeing. And then the other thing is that for your DNA, turns out that there's a part of your DNA called the telomere. It's like the tip of a shoelace, the plastic cap that protects the DNA, protects the chromosome, which is where your DNA all coiled up. And the longer the chromosome, the cap, the telomere, the younger you are. And then as we age, our telomeres kind of burn down like a fuse on a firecracker. And it turns out that intermittent fasting actually slows down the burning of the fuse. And so you can actually slow down cellular aging and protect your DNA by doing some intermittent fasting. But like as I said, rather than go into this like strict program of fasting, which by the way, many religious orders also do, like Eastern Orthodox Christians also have a lot of fasting as part of their what they do during their year as part of their religious practices. But if you do reasonable things, you can boost your defense systems as well. So, and that's different than sort of these extreme diets where like you're not going to eat protein, you're only going to eat fat. Those things are, I think I prefer to recommend people eat foods that would comprise their own personal individualized diet that they enjoy, that they can continue to enjoy over the course of their life. And what I will tell you that's important is we all tend to eat too much. So if we ate less and we start with the things that we love and eat less of it, that's probably the best way. And like, I have this preferred foods list of 200 foods. Circle the ones that you love, start with those. I guarantee you there'll be more choices there than you ever imagined there'd be. And then don't eat too much of it, and you'll probably lose weight and be healthier at the same time.
That's a nice common sense and research-based approach. Well, I'm going to ask you one last question. Again, I think people are interested to know. These days, there's a lot of talk about food allergies and food sensitivities. And so people say, I can't eat this because I'm sensitive to it. Obviously it's not the same as a peanut allergy, which, can be life-threatening. But what do you say about, food allergies and food sensitivities based on your research?
Yeah, well, okay. So let's first talk about, what is a food sensitivity versus a food allergy. Mm-hmm. Listen, a food sensitivity could be anything you put in your mouth and you just don't feel right after you eat it. Like it could be something like that and you just want to spit it out, versus something you eat and it just doesn't work for you. Like your gut you just feel terrible afterwards. That could be a food intolerance. A food allergy is like your body reacts in a more specific way. And generally the word allergy combined to food really means that your body's forming antibodies, or your immune system's reacting against it. And yeah, some people, do have peanut allergies, for example. It's a great example you brought up where, people with peanut allergies, if they eat the peanut, like they'll have an anaphylactic reaction. Their immune system rears up, like a dragon, and to try to protect the body against a peanut. And as a side effect, like it can kill you. So it can be quite serious. But, I think what we're hearing about more is, this really, really disturbingly common food intolerances and celiac and gluten intolerance. And, some of it is trend, but clearly we're seeing more and more and more people struggling with foods that they can't eat, and even like normal foods, like even natural foods, even whole foods. And it, like for years, I was scratching my head, sort of trying to figure out, like, well, how could that be? Like, what's happened in the last 3 decades, 4 decades, that where people used to eat regular stuff, and now they're having difficulty. Well, this comes back to, in my mind, back to our health defenses, right? So when we eat food, it goes through our gut and our body absorbs all the nutrients it needs out of it. And then whatever's left over goes all the way down to your gut bacteria in the colon, and they kind of gobble up the rest of it, like the fiber. And then after they have their meal, they kind of go to work and make all the good stuff that lowers inflammation and everything else. That process, which I just oversimplified, by the way, that process depends on a gut that is kind of like a garden hose. It keeps everything in the hose. Well, you know what happens when the garden hose becomes leaky, right? So if you were to punch holes in a garden hose, even if you were to stick it out in the lawn, like, you're not going to get the power of the hose, and it makes a big mess. Mm-hmm. And we're starting to realize now that there are lots of foods that can cause intolerances when there's leaky gut. So a lot of people have heard about leaky gut syndrome. What the heck is that? Well, it turns out that when your microbiome is unhealthy, meaning you've got good neighbors and bad neighbors, you got more bad guys in the neighborhood than good guys, the neighborhood starts falling apart. And that's what actually happens in a lining of the gut. When you have a real disturbance of your microbiome, we call it dysbiosis. So there's dysfunctional microbiome. One of the things that they do is they cause inflammation. Like, these bacteria can actually cause inflammation. And when the gut's inflamed, it actually, it's like a garden hose that's got little holes poked into it. It becomes leaky. Now you're eating food, and now you're feeding bad bacteria as well as good bacteria. The bad bacteria are, suddenly rearing themselves up, causing inflammation, and the food just leaks right out into your system, and your immune system sees it and goes, wait a minute, that food should be inside the garden hose. How come it's leaking out? I'm going to respond to it. And then you get these food intolerances. This is the best picture I have of how we get foods that people used to tolerate that are causing this inflammation in the gut that causes leaky gut syndrome, and it's connected by the microbiome. Now, so this is, by the way, just to wind things back a little bit, this is why I'm telling you, a lot of soda, a lot of processed foods, a lot of even chemicals in your foods can actually cause dysbiosis, that bad bacteria to grow. And I think that that's probably why we're hearing about this more and more and more. So what I think is really important to do is recognize how important it is to eat foods that strengthen, that boost our natural health defenses. And if they're out of balance, try to get them back into balance by eating the foods in the right direction. So for definitely your gut bacteria, if you've got leaky gut or food intolerances or food allergies, try to work on getting your healthy bacteria to grow back. This is where probiotic foods, fermented foods, prebiotic foods actually can be really helpful. There's certain dietary patterns that are actually useful as well. I mentioned intermittent fasting. Actually, don't eat all the time. Can actually help your neighborhood and your gut bacteria repair itself. The Mediterranean diet is really good for your microbiome, and eating mostly plant-based foods with the fiber that's in them, and also the other Mother Nature's wonderful bioactives is also good for the good bacteria. And so everything that we know about generally healthy eating, right? Eat mostly whole plant-based foods, not too much, not too often. They all actually fit with this whole pattern of how to actually improve our gut health, which ultimately I think is a way to calm down the leakiness, get the neighborhood back in shape, and turn foods that might otherwise be difficult to tolerate into foods that are more tolerable. And by the way, you're eating healthier foods overall anyway.
Right. So it's a win.
It's a win-win.
Yeah, for sure. Well, wow, this has been such a fascinating and inspiring discussion, and I could keep you for another hour, but I won't. Just to wind up, I just wanted to know, what are you up to these days, and where can people find you?
Yeah, well, so I'm continuing to work on the health defense systems and looking at the foods that can do it. I'm very interested in diving into food dosing. So how much food do we need to have? I write a little bit about this in my book, but I'm really into figuring out how much food should we be of a particular food we should be having. I'm also interested in food combinations because, you hear about kale, you hear about, apples or whatever. But the reality is that when we eat, we actually are eating combinations of foods. Think about it as a recipe in the kitchen. What do all those combinations do? And are there better combinations than others? And I'm also very interested in looking at the questions that people are naturally interested in. Like, for example, is organic better than pesticide treated? Well, it seems like it should be, but I'm discovering for reasons that might be surprising. It turns out that if you have one of the things that organic plants do, like for fruits, for example, is that use pesticides to prevent insects from eating the plant. That's basically why farmers and big, industrial growers use pesticides. Organics, you can't fight the bugs. You've got to use some more natural stuff, and the bugs eat the plants. It turns out that, and this is super cool, that when bugs start eating the plants, the way that it's like a wound, like the insect eats the leaf or eats the branch, the entire plant treats it as a wound. Oh man, I'm being injured. And so what does it do to heal the wound? It produces in the fruit or in the part that we would eat more bioactives that activate our health defenses. So I did this interesting study with strawberries. So I'm looking at, how can we ramp up and optimize the defensive stuff that we eat? So anyway, I'm involved with a ton of stuff. Your listeners should stay tuned because there's so much stuff now. I'm thinking about what I'm going to write in another book as well. And they can find me really easily on my website at Dr. William Li, Dr. William Li, Li.com, drwilliamli.com. You can follow me on Facebook and on Instagram. I put up recipes, I put up news, commentaries. So it's at Dr. William Li. And you can get my book, Eat to Beat Disease, anywhere books are sold. And I'm really looking forward to, getting people's feedback and response.
Amazing. Well, before we leave, I always like to ask my guests for a call to action. And obviously, you've given plenty during our discussion, but maybe one last thing as a takeaway for the listener.
Yeah, my biggest call to action is to really think about what you love to eat in the healthy parts of the market or the grocery store. Get into the grocery store or go to a farmer's market and look around you. Take a moment. Pause, look around and say, what is it that I love? What is it that I like to eat? And think about that, because if you start with a healthy food that you already love, you are way ahead of the game. And that's the best way to embark on a lifetime of healthy eating.
That's an excellent and, again, very common sense call to action, which I'm sure the listeners will appreciate. Well, I just want to thank you again for coming on the show today. I think there's tons of food for thought, and we're going to be digesting this conversation for quite a while, I believe.
Well, thank you. Thank you, Dr. Sirota. It was my pleasure.
That was part 2 of my interview with the brilliant Dr. William Li, and I'm Dr. Marcia Sirota. If you like this podcast, please review it on iTunes. And don't forget to sign up for my free monthly wellness newsletter at marciasirotamd.com, where you'll also learn about my new online courses.